Hi, guys. Thanks for joining us on the Activate and Illuminate podcast with Mel. I'm your host, Mel. Together, we're going to be diving into some stories of ordinary people doing a little bit of extraordinary things. People who've maybe pushed their bodies, their mindsets, or maybe society's paradigms. So you're going to find yourself maybe wanting to laugh, cry, or even be inspired. We would invite you to share, like, and subscribe, to sign up for our newsletter as well on activateandilluminate.com. Now, just keep in mind that this information that you are going to hear is informational and educational for entertainment purposes only. This does not constitute professional advice of any kind. The views expressed are those of myself and guests only. Listeners are encouraged to seek professional and legal advice regarding their own situations. So, thank you for joining us. We appreciate your time, and thanks again for being here. Hello, everyone, and welcome. So today on the Activate and Illuminate podcast, I have Alan Brough. Now, Alan is a business owner. He's a co-owner of ReVitalife Wellness out of Sherwood Park. He's also the executive director of the Natural Health Alliance. He has a background in health, in financial services. He's an author. He's well written. He's well spoken, and he has a lot of information for us and a perspective on history that I think that we are going to be well suited to listen to. So welcome, Alan.
Well, thanks very much. I appreciate being on the podcast. Just a small point of correction. I'm the executive director of the Canada Health Alliance. So it's just the name Canada Health Alliance, which has been around for probably about 5 years now. And I've been with them for about the last four and a half years. I've been with them for a little while. And that's really what got me started on my whole journey into healthcare.
Okay, my apologies. Tell us your journey into healthcare, Alan. Tell us what that entailed.
I mean, I would never have considered a career in healthcare, and it was never even on my radar. And I went initially, I was in marketing and advertising, actually. I left school without a great deal of qualifications. In fact, I was told when I left school that I, clearly didn't have the intellectual aptitude to do anything of significance. I should maybe think about woodwork. In fact, that was literally what they said. They said, whatever you do, don't do anything to do with writing or reading, but writing particularly, keep well away from that because your writing age is 11 and your reading age is 12 or whatever. And, when people do that, you just get mad and say, well, I'm going to teach you. So I became a professional writer. I became a copywriter in advertising just to, teach this ex-professor of mine a lesson that I wasn't that stupid. To me, that just shows that with advertising, it's all based on packaging and lies, because I managed to, build a successful career in that. But it was only really when I came to Canada, I came to Canada about 15 years ago, so quite a long time ago we moved to Canada. I worked in the financial sector, but started to get concerned about the quality of healthcare, because coming to the first world, we had an impression of everything being perfect and beautiful and the dream of coming to the first world. It was like winning the lottery to be able to come here. But then we started thinking about, this is not really working, this sort of socialized healthcare that we saw in Canada. The wait times were quite long. The empathy wasn't really there. So I became more and more interested. And then about, as I say, 4.5, 5 years ago, I was lucky enough to get a job at Canada Health Alliance. And that really opened my eyes to a whole lot of things that were going on. A lot of our members are healthcare practitioners, doctors, nurses, RNs, that type of thing, homeopaths, physiotherapists. There was a whole range of modalities in there. And it was really an incredible education. Hence, we actually started working on our own healthcare center and established that as a business. But mainly it was my immersion in understanding why things weren't working with healthcare in Canada and what should be done about it. And I had this huge resource of, I think we've got about 6,000 members across the whole of Canada, half of whom are ex or current healthcare practitioners. So I really got a good view from a range of modalities as to what is going wrong, what should we do about it, and why it is so important. Because at the moment, as we all know, the trajectory is not getting better. And yet they say that the measurement of a civilization is how they treat their most vulnerable. And I think that's a measure of our civilization. How do we treat our most vulnerable? And it's not looking great, actually.
Not that well.
there's work that we need to do. And that's really where it piqued my own interest and really sort of became a passion. And so now I'm very passionate about how do we improve healthcare and how do we start just showing empathy again? Let's be civilized. Let's care about the people around us. I think that's important.
Yeah, even as you said that, how do we treat our most vulnerable? I had images flash across my face of the homeless population, the veteran population, vulnerable children population, thinking if we had to score ourselves right now, we wouldn't be doing that great here in Canada.
Yeah, and it's tragic because, having seen a lot of third world countries, they really understand the importance of the family unit and the broader family dynamic. The support structure is always there. They make sure the elderly are not discarded. Whereas in the West, we definitely discard the elderly. The culture has been that we put them into sort of facilities, but how great are those facilities really? Do those people really deserve that? But we're not just geared up for looking after people within the family structure. It's not the capitalist way, I don't think. And I think that we need to think about how has the tenets and the foundation of our civilization really gone beyond the point of perfection to where it now almost starts to borderline on abuse. We need to show more respect for our elderly particularly, and we need to show more care for the vulnerable. Like the very young and the very old are always the most vulnerable, and we need to look after them. But our solutions are currently revolving around MAID and all of the rest of the issues. When you start to unpack the schooling system and the way to go right to the beginning, childbirth is dealt with as a sort of almost industrialized process. I think it a long time ago stripped out real care for both the mother and the child. And how does that impact the child? There's a lot of things that I think we need to relook at fundamentally and say, what was the point of perfection? What would be the perfect way of doing this, and how have we drifted away from that? And let's go back to the fundamental idea of do no harm, because that is the Hippocratic Oath foundation. Above all, do no harm. And yet I think maybe as unintended consequences, or maybe as I say, unintended consequences, maybe that's why we've drifted away. But so many times it seems like there is another motivation, and it's often profit driven. We sacrifice empathy and care for profit in the system. And again, that's probably the downside of extreme capitalism. Back in 1989, 1990, I think it was, when the wall came down, I thought, well, that vindicates capitalism as the right process, of the right political structure, because you had capitalism and communism collapsed first, therefore capitalism has to be the better of the two. But they were both flawed, I think, now we realize. And that's the thing. It was just a matter of time. We don't have a perfect system. It's got to be a hybrid in between. So I think that we accepted capitalism at that point of time because it looked like it was the one that survived the longest, therefore it should be the better of the two. Might have been the better of the two, but it's not necessarily better for humanity. So I think we've got to really step back and go right back to those fundamentals and say, what is right for people and what is going to be sustainable economically? Because you actually need both. You need the empathy, but you still need to be economically sustainable to survive and grow as a civilization in the long term. It becomes quite philosophical after a while.
Tell us your background and the country that you came from.
I was actually born in Zimbabwe, which is interesting. So Zimbabwe is in Central Africa, which I'm sure most of you probably know. We had a particularly turbulent background there. We had a war that lasted about 10 years, and that was through the time that I was growing up, and that obviously affects you. It was an ideological war during the Cold War. It was one of the Cold War flashpoints. It was interesting because it was in Africa, and it was a war against communism, communist encroachment. And as a result, it's always been sold to the world as being a racial war, because Africa, it's got a bad racial history. We know of lots of racial atrocities throughout Africa, and that was really consolidated in the mid-late 1940s in South Africa when they adopted apartheid as a law. And the tragedy of that was it made people think the whole of Africa was under the apartheid laws. Now, people naturally gravitate towards their own communities, so they're like-minded people and people of the same color, the same tribe. It's a basic tribal instinct of humans. But without the laws of apartheid, there were a lot of countries that I think were fairly successful in Africa where there was racial cooperation. And we can look at countries like, well, I was going to say countries like Rhodesia and countries or provinces like Katanga. Katanga was one of the richest provinces in the Congo, and they adopted a very multiracial approach to their society. And I think those would have been the models that could have really turned around the history of Africa. But as I say, I sort of grew up in that turmoil of post-independent Africa, pre and post-independent Africa. And it was violent, but mainly pitted against communist insurgency. And that was really the environment that we grew up in. It was we were politically betrayed, I think, personally. I believe we were politically betrayed by the United States and Britain. And because we were outside of their political view of the world and the message that they were trying to sell for their own political gain. Consequently, I spent a long time studying history and trying to tell the story, the untold story, of what actually happened militarily and politically in that part of the world with countries like Katanga, countries like Biafra. Canada was very involved actually in the Biafra airlift in the late 60s and 1970 before that province collapsed. And they were very involved on the humanitarian side. But today, 45, 50 years later, most people have forgotten all about that. And to me, the tragedy is that so many people lost their lives during that time in Africa and have been forgotten by the West. I think that's a tragedy because every person that suffers and dies suffers as much as we do. Who are we to say, well, those are marginalized people? You know, we don't know anything about them. We don't care. We need to bring back that empathy for humanity. When people suffer, to me, we all suffer, and we need to bring that back. And we see the same thing now. You know, people are politically outraged about the war in Iran. But there was a regime that just 2 months ago was machine gunning crowds of protesters, killed 30,000 of them. Nobody seems to talk about that. That's the lack of empathy of the suffering of people on the street. And we need to bring that back. And I think that's sort of growing up where I did, that's sort of embedded in me, that need for real empathy, no matter who the person is, if they speak a different language, if they've got a different skin color, if they pray to a different God. We're all ultimately humans. We're all ultimately the same. And the chances of us being born in a privileged Western society where we have a middle class, which many people don't, is just the luck of the roll of the dice. And I think our test is going to be, how do we deal with those around us, even just in our own community? How much empathy do we really have? How much do we care about those people around us? And I think that's what we'll be judged on. And I think that we need to take that challenge seriously. And that's how we can make the world a better place, even if it's just our own community. If we all just help one person, the world will change overnight.
Yeah, imagine that if we all went out there into the world to just do something good for one person. I heard somebody say once when they're talking about marriage, and they said, like, if every day you just wake up trying to make that person that you've married life a little better and stop worrying about what they're not doing for you, you'll be fine. And it's kind of like that with society as well. It's like if we just decided that we were going to make someone else's life a little better. So tell us what you are doing in Sherwood Park and how you're making people's lives better, because I believe that you are.
I think we've got a fantastic job, or I've got a fantastic job, because every day we make people feel better. And we opened our health center in Sherwood Park about 3 years ago. It was, I think, in June 2023. So just coming up to 3 years ago. And it's something that we'd been working on for about a year before that. And looking at the state of healthcare in Canada and the fact that it is really overloaded, there's a lot of cracks appearing in the system. Emergency wait times are more than 12, 14 hours as a national average. If you want to see a specialist, your wait time could be sort of 6 months, and none of that is really good for people. We heard quite recently, about that fellow who died in an emergency room waiting for treatment, and this is really showing the signs of an overloaded system that is just buckling under the pressure. And we know that there is a tsunami of healthcare issues. We've seen a whole lot of issues happening over the last 5 or 6 years. The real spiking of things like cancer, turbo cancers, all of that sort of thing, clumping of the blood, poor circulation, all sorts of things. So we have a real health need and a system which is buckling under the pressure. So what we did is we looked at what would be a better way to actually help improve people's health and well-being. And one of the things that we really focus on is how do we help fortify the body's ability to get back into balance, because your body will always treat the root cause of your chronic conditions. Our Western medical system tends to treat the symptoms because often it just doesn't know what is the root cause of your personal condition. But if we can help your body, your own body, treat itself or get better and be fortified in getting itself back into balance, because your body is very good at healing itself. We just need sometimes to support that, especially given all of the poisoning that we're getting in the air, the soil depletion, the water supply, the EMFs that we're subject to. There's a whole lot of things that are weakening our body's ability to get back into balance and heal itself. So if we can fortify that, your body will always treat the root cause of chronic conditions first, and then those root causes will dissipate, and then you'll actually get better. And that's really what we want to. We don't want to manage our symptoms to the point that we can function. We want to actually get better and flourish. And I think that's really the fundamental thing that we wanted to do with our wellness center, is how can we help people get their bodies back into balance and allow their bodies to treat root cause. So we do that with a couple of things. Got a system called the Energy Enhancement System. It's a scalar energy system. And we were about the 10th center in the whole of Canada in Sherwood Park here when we opened. I think there were about 10 that opened before us. The technology came to Canada. I think the first public center opened about 14 or 15 months before we did. Actually, in Vernon, BC was the first public center in Canada. And then over the period of the next year, 10 other centers opened. And now I think we've got about 30 centers across the whole of Canada, okay, of which there's about 5 in Alberta. We're the only one in the Edmonton area. But this scalar energy field is very good for raising electrical charge and vibrational frequency of all the cells in your body. And what we do is we lift that up to a healthy level. So all your cells start to function as healthy cells. Obviously, that dissipates over time, and exposure in the system really helps. But that's the basic principle, which I think is a good system, a good principle. And it's very non-intrusive and very passive, which, again, I like when it comes to healthcare treatment. We also offer things like red light therapy, oxygen therapy. We have a great bioanalyzer, which does body scans, which I think is also important, because the more people can understand the balance of their body and how their body organs and systems are functioning, it gives them a bit of insight into what they need to pay attention to. So it's all about empowering you to become your own health authority, empowering you, educating you, giving you insight so that you know what your own body profile is and how do you deal with that. Because we all know we should be taking vitamin C, we should be taking vitamin D, we should be doing a whole bunch of things. But is it really right for you? Because these things can be quite expensive. We all know what the cost of living is like. So if you've got some insight into your own body profile, you know what you spend your money on is making a difference to you personally. It's no longer general, it's specific to you. And that's another fundamental thing that I believe in, is that healthcare is about you personally. Everybody is different. You can't generalize healthcare because everybody is slightly different. What you've got to do is understand what makes up that particular individual, the person in front of you, what makes up them, and what led to the root cause of their chronic conditions, and how do you address that to bring them back into flourishing. And we need to look at it holistically, so that it's your physical well-being, your psychological well-being, your spiritual well-being, and even these days, particularly your financial well-being. If you've got all 4 of those, then you're truly well, you're truly whole. And that's really what we want to get back to sort of step away from the focus on physical, which I think our healthcare system does tend to do. Focuses on the physical, a little bit of mental health. It doesn't really consider the importance of spiritual well-being at all. And yet we need to bring those all back into balance. So I think our philosophy is really embedded in our business, which, as I say, we opened about 3 years ago. And every day, I just love the fact that we can chat to people. It's a face-to-face business, and people feel empowered when they leave. They also feel hopeful. I was chatting to a woman just a couple of days ago who had recently got a really disturbing diagnosis and could hardly sort of talk for more than a few minutes before tearing up again at this diagnosis. And those sort of reactions, because it crushes you psychologically, it always has an impact on your physical condition. And yet, after a couple of meetings with her, giving her a bit of advice and basically just giving her hope her whole attitude has changed. And I think that she'll do well because now she understands what that diagnosis is. It's just an insight into what's happening in your body, and it's giving you a heads up to do something about it. There's plenty of things you can do about it. It's not just what a certain practitioner is telling you. Take a second opinion, look at the alternatives, find the natural, wholesome alternatives, change your lifestyle, change your diet, get some exercise, spend time in the sunshine, all the things we're told not to do. And, I think that can be profound. And that with hope and positivity, I think then we're starting to unleash our true power as humans. And we unleash the human spirit, which in itself is hugely healing. So yeah, it's a great business. I must say I love our business.
This episode brought to you by protandemcanada.lifevantage.com. What if you could turn on your body to work like it was supposed to? What if you could have it remember how to handle toxins, stress, and the environment like it used to when you were young? What if it worked for your pets too? What if this is not about supplementing something that is missing, but activating something that has gone dormant? About actually turning on your body to make these things again. Learn how to activate your body now. Check us out, protandemcanada.lifevantage.com.
So, couple things there. When you talked about the loss of hope, what do you see? I feel like that has happened a lot over the last few years. This loss of hope from a whole bunch of different factors. But do you see, particularly, I would say, it's almost like people have. There was a certain, particularly during the lockdowns, I saw that loss of hope come over people. That loss of, and I still feel like society in general is still dealing with it, and even more so maybe now. Do you see that affecting people in that?
You and I think that it's intentional, and I think it's much more pervasive than we realize. When we think about our current situation, and again, sort of going back to the sort of war in Iran, which is dominating the headlines as it has for the last
Sure.
4 weeks. Well, I think it's now 3 weeks and 1 day as of today, but it has been going on for a few months. And before that, we had other issues. But it's all about clickbait headlines, which are demanding attention because of the dramatic message that they're telling us. So
Mhm.
you can see headlines about anything, healthcare, the political situation, the military situation, everything has fear and loss of hope with it. We can never win this war. It's going to end up as a nuclear war. European capitals are now in missile range. It's all about this sort of crushing, the end is nigh type of headline that we see. And yet, sort of growing up as I did in Africa and in a military situation, in a war situation, often people say to me, oh my God, that must have been terrible. Yeah. But it was also incredible because it really showed me how communities can come together, and it showed me that there's always silver lining, and that in a certain situation, your personal situation is never really as bad as it appears. The headlines are always terrible, and we need to think about that as well, because I think it is a strategy to disempower us, to stop us manifesting the future that we want. And it depends really how far you want to go down that rabbit hole. But scientifically, it's been proven that if we're positive and if we are grateful and if we see the silver lining that we're actually in, it does manifest that, and it increases the chances of health and happiness. I think about books like The Power of Eight and The Intention Experiment that I think Lynn McTaggart was a woman who wrote those two. Incredible woman out of the UK. And it proves how when people focus on positivity, they manifest positivity. And this was not religious or spiritual or anything. It was just really proving a repeatable experiment about when you focus on positivity, your life changes. And I think that's the thing, is when we being fed this story of hopelessness, we become hopeless. And then we selfish, because everything is sort of going down the toilet as fast as we can see. We may as well cling on to whatever we can. And inevitably, we try and get out of this whirlpool by standing on the shoulders of others. And then we lose empathy for those around us. We lose care. We're not going to help those around us. If we all helped each other, we would be able to solve many of our problems. So I think it's almost like a disempowering intention. But what we've got to do is focus on things are not that bad. And as long as we've got the people around us who are prepared to look after us and essentially share their last meal with us, we'll be fine. And that's another lesson that that I learned growing up in Africa, where people are generally very poor and they struggle for everything. I mean, I lived for a couple of years or a year or so in Tanzania, and the average income in Tanzania is $1 a day. That's average. It's not the poorest, it's the average. And then I came and lived in Canada, where to go and watch the local hockey team play. I live near Edmonton, and I watched a couple of the Edmonton games. $350 to buy a ticket. That's a year's average income for an average Tanzanian. And it made me realize, oh my God, we have nothing to complain about. When we came here, the big thing that was on everybody's minds were these terrible potholes. And I just thought, oh my God, I've arrived in paradise because that's our biggest problem. And yet, with all of that, we don't really care about those around us. We still have homelessness in Alberta or in Edmonton here, and in every city. I mean, you look at places like Toronto and that sort of thing, there's tent cities now, which we never had 15 years ago. But with all of these benefits and these trappings of our civilization, we've lost that empathy. In Africa, there's generally people are prepared to share their last meal with you because they know they're going to need somebody next week to share their last meal with them. Everybody looks after each other. And I think that's something that we need to reconnect with. And it would be great if we can reconnect with that and start to practice that before we become super poor, and we should look after each other before we get rock bottom like that. Because it's easier to pull us out while we still have momentum, while we still have our homes, while we still are not living on the side of the road in the tent cities like everybody else. And often, again, that's just roll of the dice. Sometimes people are just unlucky. And most of us are on the edge of being blessed when you think about our lifestyle and our upbringing. So we need to be grateful for that, and we need to apply that. And the lack of hope does often push people into that hopelessness and therefore destitution. Even if it's just psychological destitution, you want to avoid that at all cost. Hope is really important. Hope and happiness, it's all there is.
Yeah. So your work with the Canadian, make certain I'm saying this right, Canadian Health Alliance, correct?
Yeah, Canada Health.
Okay, the Canada Health Alliance. So your work with the Canada Health Alliance, tell us what that is, because from my perspective, that group, now I don't know a ton about it, I'll be honest with you, but from my perspective, that group did give a little hope over the last, many years. So it was knowing that there was other perspectives and that there was people coming together. And just tell us a little bit about that work and those perspectives, and just kind of how it ties into this whole conversation.
Yeah, I think I certainly think I was privileged to be able to get involved with Canada Health Alliance and to get to know about them, because they were formed they started being formed at the end of 2020, and I think their official date of forming was something like February or March 2021. And it was really developed at the time of COVID. And a lot of healthcare practitioners were skeptical of the mandates around COVID, the lockdowns, the distancing, the masking, all of that type of thing. And then at the beginning of 2021, with the launch of the vaccines, there was a lot of skepticism about that as well, in a cross-section of modalities in healthcare. But anybody who questioned the narratives was made to feel like they were the only one in the world. They were definitely the outlier, and quite likely certifiably mad and insane. And a lot of people were made to feel like that, either in the workplace, in their family systems, or in healthcare if they happen to be working in healthcare. So a lot of people felt this way and started to come together. And that was really what formed Canada Health Alliance. It really started as a networking support group for people in healthcare who were feeling marginalized, or at least were questioning the narratives and we felt they needed to connect with other people who felt the same way. It was really important to give them that support structure, because the pressure and the risk of your career honestly made a lot of people feel quite suicidal, because they started to question, like, am I missing something? Why do I feel different? Am I just really, truly the outlier? And maybe I should, just accept what's going on. And so our membership grew really rapidly. We signed up more than 5,000 members, probably within the first 3 or 4 months of establishing ourselves. But very quickly thereafter, around about the time that I joined about sort of 6 months into the organization. But by then, people were craving face-to-face contact. And obviously, there was no face-to-face contact allowed at all. We were all trapped on Zoom screens and all the rest of it. But in towns and cities and neighborhoods, people started to find like-minded people. And so face-to-face networking groups started to establish. So our mandate as Canada Health Alliance to be a support and networking structure started to dissipate because people were finding their own networking in their own neighborhoods. So we looked at the organization and said, well, what is our real role? And at the time, we felt that the great travesty with healthcare was that we were all trapped with one choice. In Canada, it's quite strictly controlled that we have a government-administered healthcare system, and it doesn't really allow for any alternative system, private healthcare or anything like that. So we've all been told that we've got the best healthcare system in the world, and this is it. But whenever you have the best system in the world, but you're not allowed alternatives, you have to question that. It's the same reason why Kim Jong-il in North Korea wins the elections by 99.9%. He's the only candidate on the election. So of course it's going to be like that. So if we've only got one healthcare system, is it really the best in the world? We've got nothing to judge it with. So at Canada Health Alliance, we looked at our mandate and thought, well, what we need to do is support and strengthen and help establish a parallel healthcare system in Canada, where people have a choice. You can definitely go with a government-run system, no problem at all. But if you've got a choice and that doesn't really work for you, you should be allowed to be able to choose what you want to do. If you would prefer to treat your condition with, homeopathy and acupuncture and somebody holding crystals over your forehead, it doesn't matter because it's your health and you should have the choice. That's our view. What we realized though, after about a year or two of going down that mandate and really trying to advocate for a parallel healthcare system, we realized that it was a bit ambitious because what we first need to do is actually just educate Canadians about the fundamentals of healthcare, and the fact that they should be their own healthcare authority, not the provincial or federal bureaucrats, because we've really put our health in their hands and look where we've ended up. So we want to empower people to actually become their own healthcare authorities and have enough basic knowledge to be able to make a call. Maybe I can solve my horrible diagnosis that I've just got by fixing my diet, by maybe doing some more exercise, by maybe, taking adaptogenic mushrooms, for goodness sake. There's a lot of things you can do that are not intrusive, that don't have side effects and don't have chemicals or surgery, which obviously have a side effect and an impact on us. So that's really where we are at the moment. We're focusing on educating people on how self-care is healthcare. And in fact, next month, 24th to the 26th of April, we have a 3-day retreat conference in British Columbia called Self-Care is Healthcare. It's our Self-Care is Healthcare conference, which we are working at becoming an annual event, which is all about bringing together speakers and presenters to educate people on how they can take control of their own health and their own ways that they can improve their own well-being. And I think that that's really what our focus now is. And I think that we are giving people hope, we're giving people empowerment, we're educating them, and it's taking the fear off or away from a lot of people where it just seems public health is collapsing, and it is to an extent. But it doesn't have to be that way for you personally. You personally can do something about it. And it doesn't matter how bad your health is. It doesn't matter how terrible your diagnosis is. Got some terrible thing and they give you 3 months, 4 months, 6 months to live. They don't know. But when you get that diagnosis, you give up. And then, sure, you're only going to be around for 3 months. In Africa, often people would be cursed by the witch doctor. Somebody would take an omen or curse out on you. We called it tagati, where I came from. So somebody would put tagati on you. Witch doctor would say, well, you're going to be dead by the weekend. And sure enough, you were, because you believed it. The supernatural is a part of daily life there. They don't question it. Sure, I'm going to be dead by the weekend because the witch doctor says so, so you are. And that's a little bit of what's happening with us as well. We mustn't allow that to happen. We have to take control. It doesn't have to be the way the man in the white coat tells you it's going to be. It's all about your attitude, your zest for life. Don't let that be crushed by lack of hope, because there's plenty of reasons to have a lack of hope. You just have to listen to the TV for 15 or 20 seconds and then beginning to feel nauseous. Oh my God, we're all going to die.
Yeah.
It's never going to happen. Humanity will always survive. We just need to make sure we're in those pockets that survive. And, the way to look at it is we live in interesting times. I lived in China for a while, and the Chinese, we all know they've got this great blessing and curse. May you live in interesting times. And it can be a blessing or a curse. You decide. And we certainly live in interesting times. I choose to make that part of an adventure. And that's how we have to do it. My God, this is a roller coaster and it's free. So let's enjoy the ride.
So right now it's entirely plausible that there's people out there that are listening that are perhaps overwhelmed with conflicting information. From your perspective, where would they go to learn more or to become more informed or more empowered?
It sounds like a simple question. It's a little bit more tricky, though, because there's so much, the good old misinformation and disinformation out there. So we've got access to a lot of information, but you just have no idea what's right and what's wrong. So what I would mainly encourage people to do is to be curious. Don't take at face value what you hear at first diagnosis. Canada Health Alliance publishes a weekly newsletter, and not long ago, probably about 3-4 weeks ago, maybe a month ago, we wrote an article on the importance of second opinion, and the statistics are shocking. The statistic is that if you get a second opinion, on average, 80% of the time, I think it's 81%, I can't actually remember the specific, but it was about 80% of the time, you'll get a different diagnosis. So 4 out of every 5 times when you get a second opinion, it'll be slightly different or significantly different, or the treatment protocol recommended will be different. So, and that really highlights the fact that you're just getting one person's opinion. So for a start, what we've got to do is just know that what you're being told and what you believe and are told to believe in without question is probably just one person's opinion. And the horrible thing is that because doctors are so under pressure, the average face-to-face appointment with a doctor now, they're trying to cap it to about 10 to 13 minutes, just because they don't have time. You have so many people in the queue, you've got to get through these people quickly. Some doctors are now saying, look, I don't have time for your full diagnosis. Don't tell me all your symptoms. Tell me your top 2, and I'll try and work out a treatment plan for that. They don't have time to hear what you've got to say, because, my God, we've got 25 other people writing in the waiting room waiting for me. So they genuinely don't know. So I would never really trust Dr. Google. So you don't want to go on Dr. Google and say, oh, I've got these XYZ pains, because it'll always tell you about the most dramatic and scary things. But how to try and find credible sources for other information, even if you just start to have an open mind towards other modalities. When I'm talking about modalities, our medical system is really based on what they call the allopathic system, which is really wedded to the idea of pharmaceutical drugs and surgery and that type of thing. And to tell you the truth, some people have a downer on it because they say, look, it's such a mess, it's obviously not working. But the allopathic system is very good if you have an emergency. Have a car accident, you break your leg, they're excellent at that. They're not so good with chronic care. And in my opinion, chronic care is often treated well with things like homeopathy, naturopathy, acupuncture, even just diet. If you go to a nutritional consultant, a lot of things, especially things like any gut-related issues, can be really treated well with simple diet. Cut out glyphosate. So a lot of gluten intolerance is just glyphosate poisoning. So if you can cut that out, you want to try and minimize poisoning. But there's a lot of other modalities. So I would say the first thing to people who are feeling overwhelmed is just be open-minded towards other modalities, which are probably being marginalized by your doctor and the medical establishment. And that really, I think it comes down to, it's a competitive thing. Everybody's trying to protect their own modality. Homeopaths would recommend maybe you go to a homeopath because that's what they believe in. Medical doctor is going to believe in the allopathic system, but just be open to the range. We need a medical system which is integrative and includes everyone. So you break your leg, you have a car accident, the allopathic system is definitely the best for you. But if you've got a slow, degenerative chronic condition, very likely a homeopath, naturopath, acupuncturist, chiropractor, all of these guys are very good at those treating and reversing those sort of conditions. Not that anybody can claim the treat or cure word. Obviously, we're just not allowed to do that. It can certainly help those conditions and turn them around because they help your own body start to turn itself around and be able to bring itself back into balance. And that's what you want. Look for things that are non-intrusive, so non-surgical options, and non-chemical. Chemical drugs, I mean, you have pain, you get painkillers, the pain goes away, that's great, and we feel great about that. But the underlying cause is always there. So if you can avoid the side effects of chemical drugs, it's going to be better for you as well. So I would say my first bit of advice is be open to the alternatives and the alternative modalities, and then try and find sources that you can trust. Canada Health Alliance, we've got a website called, the URL is canadahealthalliance.org, O-R-G, canadahealthalliance.org. And in there's copies of our weekly newsletter. And we've been building over the last couple of years an archive of articles and white papers and research papers that are what we would call the forbidden information. So the information that is not really being given exposure to the public, especially during the COVID years. There was a lot of that information that was just not being made available to the public. So if you want to go onto a site like that, and if you've got any questions, if there's any articles that you're looking for, email us and ask us. We've got probably 3,000 or 4,000 documents that have been amassed over the last couple of years, going back to 2021, 22, when we started this project, because there is a lot of good information out there. And the more you start to unpack that sort of information, the more it just opens your mind to the alternatives. And I would say Canada Health Alliance is probably a trustworthy source of a lot of good information. And we've got a network of 5,000 or 6,000 people, half of whom are healthcare practitioners or ex-healthcare practitioners, and are often very willing and happy to help give people guidance and advice. Not that we offer a service or anything, but it's more about empowering people to find information and just find like-minded people to talk to, because quite often that's what we need. And then I would look at things like energy healing, the energy enhancement system, Rife frequencies. I think Rife was a genius and he was marginalized. Just recently, probably in the last 6 months, independent research really confirmed that a lot of what he said at the time and was discredited for is actually provable and can be done and proven with repeated experiments. So, a lot of these type of things that we haven't given any credence to are being proven now to actually really make a difference. And again, it just requires an open mind. So first of all, open yourself to the possibilities and find sources of information that you can trust. And I think Canada Health Alliance is a good one, obviously, because, I'm close to it and I know about it. But there are a lot of other ones, people like the CCCA in Canada here, what are they called? IMA, I think it is another one that I'd recommend. Vaccine Choice Canada have got a huge amount of articles on their website as well. And if you just sort of cherry pick through some of these organizations, there's a lot of them. And then a lot of very good writers like Dr. Joseph McCullough. He's got a fantastic website, open, free to the public. And he's been amassing this sort of information for probably the last 20 years. Good search function, go in there, type in the search function, you'll find a lot of information. And that's really the thing, is empowering ourselves to learn and be able to choose what's right for us. One of the things that I think is happening with humanity at the moment is people talk about this, great awakening. And I think to a degree it is. What I'm seeing is that people are becoming much more curious and they're becoming much more interested in taking control of these things. And I think that curiosity and that sort of almost intuition is coming back. And I think that we need to allow and embrace our intuition, because I think when we think about this information field that we live in, I think that if we start tapping into our intuition and trusting it a little bit more, we would be able to avoid a lot of the pitfalls that are being put in front of us at the moment. And the first thing that makes us make bad decisions is fear and hopelessness. So we're being made to be fearful and hopeless. So we just do what we're told.
So we make bad decisions.
So we make bad decisions. And, we know people that made bad decisions over the last couple of years, which will be hugely fundamental to their quality of life going forward. And we don't want to make those sort of mistakes. We've got to be strong. We've got to be confident. We've got to be hopeful. And we've got to think about our decisions deeply and sense our intuition. Is this really right for me? Should I really do this? And question everything. Because, as I say, it's hard to know what the good sources are. And when we are being given advice from people in authority, the history of the last decade, I think, has taught us that that's a dangerous and irresponsible thing to do, I think. As I say, it's my personal opinion, but I would question everything. For your own good, we should question everything, especially if you're making health decisions for your family, for your kids, that type of thing. You want to protect them at all costs and find out what the agenda is behind information that you're getting. Is it being financed in any way by a business that can make money from that decision? And I think, unfortunately, healthcare has prostituted itself for profit to the detriment of public health. And I think that the realization of that, we're beginning to see that in the collapse of healthcare and the strain that it's under. And you want to make decisions for your own healthcare based on really what's right for you and what do you feel is right for you. I think that's really important.
I agree. When you talked about some of that stuff, I was curious on some of the stats of the healthcare, but myself, I personally experienced a stat that I didn't necessarily want to experience, but just a medical mistake. And it was interesting. So I had found out that I had a little parathyroid node. But in the meantime, so I was seeing this doctor, and in the meantime, they came back and they told me that I was diagnosed with 5 counts of thyroid cancer, and I was shocked. So I had to wait about 6 months for these biopsies, and I'm laying on this bed. I took 13 needles in my neck to get these biopsies done, and they said we need to check her file because they were using the ultrasound and they couldn't see any of this cancer. Well, it turns out, Alan, that they had put somebody's file into my file named Mohammed. So they check my file. I'm laying on the
they've stabbed you in the neck 13 times.
After they've stabbed me in the neck with freezing 13 times. It was only then that they discovered that I indeed was not Mohammed. And that I indeed did not have thyroid cancer. But when you talk about where the places that your mind goes.
Yeah. And for 6 months. So for 6
months.
Living in absolute fear, which is probably the stress of that is probably triggering other issues like stomach ulcers and that sort of thing.
Yeah, it was that's what upset me the most is that for 6 months where I let my mind go of, your children are, have the possibility of not having a mother, just where you let your mind go. That's what upset me the most.
Yeah.
So,
well,
yeah.
The shocking thing is that statistically, and these are statistics from about 2 years ago, so they're not particularly current, but it's probably got worse. About 2 years ago, the healthcare system was the 3rd leading cause of death in the United States. Now, I don't know what it is in Canada, but it's probably higher because the healthcare system, if you add MAID to that, then it's wholesale slaughter. But in the US, the healthcare system up until 2 years ago was the 3rd leading cause of death. It is outrageous. And most of it is on that sort of misdiagnosis or medical errors. Or over medication, which leads to other things, addiction. There's a whole lot of sort of things that can happen in there. But it just shows you how serious the situation is. Because that is unforgivable. If it was another Melanie, well, maybe you could sort of justify it.
Yeah.
Clearly you're not
Mohammed.
Yeah, and yet they're more than happy to stab you in the neck 13 times. And the intrusion of the allopathic system particularly, which, as I say, it's really focused on chemical drugs and surgery. And if you're a surgeon or a specialist in any of those areas, you actually need to have as much of that business as possible to keep your salary up. So they're more than happy to, start, stabbing people and slicing bits off and that type of thing, because it's what they know. And I don't think it's necessarily always done from a malicious point of view. I don't think, I think there's a lot of evil in the world, but I cannot say that every doctor or every specialist is an evil person who's trying to harm humanity. But that's what they know. And my God, for me, when it comes to me or my thyroid or my neck, when I hear what's happened to you, is I don't think that that's necessary. What they know is not necessarily right for me. It doesn't feel right for me. I want to find an alternative. And that's why we need to have medical choice. Do you want to go that route or do you want to try something else? And if you do, you live by the consequences. And that's another thing that I always learned growing up in the third world is, you're going to live by the consequences because there is no insurance. There is no compensation. And so consequently, it's hard to force people to do stuff because everybody's sort of fending for themselves, but you're responsible for your own actions. And sure, I believe the average Canadian would be more than happy to take responsibility for consequence of actions. I want to have the right not to have my neck stabbed 13 times, thanks very much. But if that happens to turn out to be the best thing and I chose not to do it, well, I'm going to live by the consequences. But I'm still happy not to have my thyroid stabbed 13 times. We should have that choice because we seem to have gone down a path a little bit too far. The whole medical education is just about entrenching that allopathic model. And I don't think that's necessarily right. Up until 4 months ago in the US and Canada, the average doctor would get an afternoon of nutritional training, literally in their whole medical degree, which would be 4 or 5 years. They would get an afternoon summary of nutrition. Now, Robert F. Kennedy Jr. has, I think it's going to be something like 3 or 4 months. So he's made a fundamental change to that, which is a good thing. That hasn't been applied in Canada yet. But when we realize and we hear those sort of things, we realize those people are only trained in a certain modality. And thank God for the curious who are trying to look outside of the box because they care about the patient in front of them. Those are the true heroes, and thank God for them. But unfortunately, a lot of doctors, I think, are about to lose their jobs because all they do is prescribe drugs, and AI can do that very effectively. In fact, it can do it more effectively. So doctors, unfortunately, I think, have relinquished their unique power and their unique role and have basically given it to AI. And so the real doctors of the future will be homeopaths and naturopaths, I think, because they will be left and they tend to treat the patient in front of them. So it's interesting to think about the implications of all of this that's happening. But yeah, I think your story is horrific, and it happens a lot more than most people realize.
When I started looking into it, and I was horrified by the actual stats and horrified by the amount of people in my life that said, oh yeah, I went for a knee surgery and they ended up doing the wrong knee. And
Yep.
I knew that I had a little something that had to be dealt with surgically. But I told that doctor, I said, you listen here. If I come out of here with anything other than what I am in here for, it better be a tummy tuck and a new set of boobs. Because I better be looking better coming out of here than I do going in.
Well, I just feel sorry for old Muhammad who's had his tummy tuck.
In all likelihood, I would probably decline those. It was I realized in that situation of just how many people out there are experiencing things like this. So that leads me to something. When you said the Hippocratic Oath, what's your experience of that? Do you think that the perspective of that has changed in our medical system from what it used to be?
Absolutely. The Hippocratic Oath was written about 2,500 years ago by Hippocrates. And I think it was really enlightened because what he was saying is fundamentally what we've got to do is, first of all, do no harm, but really work with the needs of the patient in front of you, deeply respect privacy and confidentiality, and basically do your best for that person in front of you, irrespective of how much you're being paid or what sort of monetary conditions there are and what sort of political conditions there are. So what he laid out was an operating principles for people to really care for the individual patient in front of them. And that's fundamentally what we should be focusing on under that big, broad umbrella of firstly, do no harm. Now, when you look into it, we all know about the Hippocratic Oath, but when you look into it, America and Canada, and obviously sort of Canada's our primary point of focus, but there's been a drift away from this over the last probably 40, 50 years. At the end of your graduation, you recite the Hippocratic Oath. And with this drifting away from the Hippocratic Oath, we're now allowing people to do their own oath, to write what they're going to promise. So there's a drift away from it in that respect. But even if people recite the original Hippocratic Oath, and there's various variations of it, fundamentally it's housed around this issue of do no harm. But even if they recite the original, they cannot apply those to their day-to-day practice because of the constraints and the rules now imposed upon them by things like the College of Surgeons and Physicians, for instance. College of Surgeons and Physicians is insisting that client files are made available to them upon request, for instance. And that's, if you want to keep your license, you've got to accept that. You can't fight against that because you're going to lose your license. And that's just one of the ways that there's this conflict between the Hippocratic Oath that you might have sworn when you graduated and the college that you're beholden to keep your license. So the colleges are not really allowing people to practice according to the Hippocratic Oath. So not only have we just gently drifted away from the Hippocratic Oath over the last couple of decades, but over the last 5 years, the colleges have imposed upon doctors the political requirement of adhering to what they say you need to do. So they've sort of said, these are the mandates, you have to do these, and you have to abide by them, or you lose your license. Consequently, a lot of people I think as many as, and again, I can't actually remember the statistic, but I think it was somewhere between 15 and 18% of doctors and nurses chose to walk away from their careers over the last 5 years, which is why we have a crisis in the emergency room wait times and the specialist wait times, because we're just not replacing them, to the point now where we're saying, well, we'll fast track citizenship for foreign doctors because we just don't have enough of our own. Well, we shouldn't have got rid of them in the first place because they were good doctors who didn't really meet the political requirements of maybe their colleges. And again, I'm generalizing, but that seems to be an overzealous political move which has impacted the quality of care. So there's those sort of things going on. But if we were to fundamentally commit ourselves and our healthcare system, be it federal and provincial, to the principles of the Hippocratic Oath and bring that back, I think it would lead to a complete overhaul in the quality of care. It's interesting. Studies have been done that if a doctor is empathetic and has eye contact with his patient, the medical outcomes are better. All they have to do is have eye contact and show empathy, and the medical outcomes are better. And yet the system doesn't allow that because you only have got this 10 to 13 minutes with the client. You're busy typing what they're saying. And in the research, a lot of doctors said, because when the researchers said, all you have to do is have eye contact and be empathetic. Why don't you? And they said, well, I've got all this damn paperwork to do, and I've got to fill out reports, and I've got to fill out claim forms, and I've got to fill out prescriptions, and I don't want to look him in the eye because I know what I'm doing is not great for it. I don't feel that I'm giving the best advice, but I have to say what I'm told to say by my association, my college, whatever it happens to be, because of those political constraints to force compliance. So to me, there's a real problem and that leads to, especially with nurses, a very high degree of depression and suicidal tendencies because they say, oh my God, I wanted to go into healthcare because I want to help people. And yet I can't help people, and I'm actually being forced to comply with a system or a diagnosis or a prescription, whatever it happens to be, that's not necessarily good for them. So there's a guilt there as well. All of those psychological pressures lead to burnout really quickly. So we're basically destroying the good people in healthcare through this sort of conflicting pressures that we put them under. If we were to re-embrace the Hippocratic Oath, I think it would allow for genuine care and empathy primarily. And then I think that the outcomes would certainly start to turn around. But it's always easy to be an armchair specialist and say, well, I think this is great. But actually, if you think about it logically, there's so much political weight, tension, conflicting requirements on the healthcare profession. Surely just re-embracing the Hippocratic Oath and allowing doctors to abide by that promise would make a fundamental difference. And if nothing else, it would show the person in front of the doctor that we actually do care about you. We want to hear your story. We want to know what do you think's going on, because only you know what's going on. So often we trivialize people. They say, oh my God, I've got this pain. And we say, it's all in your mind. Off you go. How awful for the person. You just feel unheard, marginalized, and basically rejected by the system because you don't fit into a little box. And I think that we could improve things dramatically if we just started listening to patients and really wanting to try and help them without doing any harm. Whether we could ever get to that, I don't know if we could, but we should at least try.
I agree. I saw when you talk about that trivialization, I saw a lot of that as a way to explain away symptoms or a way to explain away just conditions that were present over the last few years of, whatever situations. And I think when you talk about 15 to 18%, that stat blows my mind. But at the same time, if you were sitting there close to retirement and you knew that you were being asked to do stuff that you didn't necessarily feel comfortable with, 100%, you'd want out.
A lot of our members of Canada Health Alliance were in that position, and a lot of early retirement, quite a few of them actually went to war with their colleges to try and defend their rights. Obviously, all of them lost their licenses, and then they would become maybe consultants, health coaches, whatever, or just basically went into early retirement. And some of them changed their careers entirely. But the damage that's been done is huge because we're on the receiving end of that erosion of the healthcare system. So when we go, that's why we have things like misfiling of critical information, replacing the wrong knee, for instance, because people just don't have time to care and to pay attention because it's under-resourced. And it's basically a disaster. And we've also lost trust in the system. When a certain critical mass of the public lose trust in a system, inevitably it's going to collapse. And I think we're getting to that. We're getting closer to that point, I think. Because a lot of people like you have had those experiences, and it's like, well, I don't know if I'm going to trust them again.
Yeah, for certain. Tell me about, you mentioned a little while ago, MAID. Tell me about your perspective of that, and for people that don't know what that is.
Well, I think MAID is an interesting reflection of a fairly rotten system, I think. Now, I don't have a radical opinion on this because I've seen lots of extreme suffering with people who have terminal conditions and are unable to recover. And in those situations, I think there should be a consideration. How do we stop the suffering of people like that? But what I really object to is how MAID, which stands for Medical Assistance in Dying, which is basically euthanasia, I think how it's been industrialized in Canada is shocking. And reasonably quickly, too. I mean, this all started probably over the last 10 years. It hasn't been around for long. In places like California, I think it's been around much longer. But currently, Canada is killing more Canadians through MAID than every other country that offers it put together. And I think that might be by twice as much. And then, as I say, we always need to understand, why do certain things happen? So I want to know, why is MAID being pushed so hard? Why is it really becoming such a big thing? And, we've all heard that expression, you've got to follow the money. And then when I start to think about how much money is made from the sale of organs, is that a dark side to MAID? Is that a driver of MAID? Who knows? It could well be. It's certainly something that we should be thinking about. But the fact that it's become so industrialized here, I think is a cause for concern. I've had quite a few of our clients coming through our wellness center who have succumbed to MAID. They've applied for MAID and been, sort of removed from the planet, if I could put it that way. And it's, in my opinion, it really is too easy. I think that there are other ways, because also with these people, they've lost hope because nothing is helping them. But when I say nothing is helping them, nothing in the allopathic system is helping them. And we have all of these other practitioners in these modalities, which they're not really allowed to consider. They are allowed to consider it, but they're told that it's just weird or woohoo or whatever it happens to be. And you've got to trust the doctor because, I mean, my God, you were talking about your life here. From birth, we channeled into this belief in the system, and we keep being told it's the best healthcare system in the world. And, don't question it. But how much of that is indoctrinating people into thinking, well, there is no hope for me. I'm in pain and I just want to get off the bus now. And I think that indoctrination and that pressure is part of the problem. And again, I just think that if we were really about doing no harm and doing the best for the patient in front of us, surely we would be open to saying, well, why don't we try homeopathy? Why don't we try, acupuncture? Why don't we try walking in the sunshine? Take the dog for a walk. It'll people, statistically, we know that people with pets live longer than people without pets. There's simple ways that we can try to enhance the quality of their life if we really want to. But I think it seems to have become an industrial process, which is a bit like a runaway train at the moment, in my opinion. Obviously, all of the things I'm talking about are my opinion, but it does seem like that has become a big thing, much bigger than it should, given the circumstance. If we really cared about people and teenagers particularly, we had an interesting training session just last week on what's wrong with kids today at Canada Health Alliance. And so much of it boils down to screen time, poor diet, and the breaking of their ability to form social contact. And that really goes back to the whole mandates of COVID, where, we didn't allow them to socialize. I couldn't even see people's masks. Kids particularly suffered with that. And now we're extending MAID to, teenagers and whatever. I think in Quebec, they're talking about even younger people being able to get MAID. And then, they're not even too concerned about getting parental, consent or knowledge around that sort of thing. So it is there is a time for these things. There always is. And I acknowledge that. But we have to just be careful about why has this become industrialized? What is really going on? And what is the reason for that industrialization and the hard push to get as many people onto that bus as possible? None of it feels good or right to me, I don't think. So, but I have seen extreme suffering, and I do think there is time for it sometimes. But that's with all things. With all things, you've got to avoid the extremes. I always use the analogy that the extreme political left and the extreme political right are on each side of us. But where do we live? What maintains life? Everything in the middle. The heart, the brain, the organs. They're all in the middle. The extremes are far away. And I think with MAID, we've gone down an extreme. We need to just bring it back to common sense, actually. Sometimes this person is terminal. They're going to die any day. They're in extreme pain. They're screaming. We need to help them. That's common sense.
Yeah, we'd do that for an animal.
Exactly. But when a teenager says, I'm depressed and I want to kill myself, there's other things that we can do instead of saying, sure, let's just phone this number and they'll be here tomorrow afternoon. And it seems like, we're going down the convenience of putting you out of your misery a little bit too hastily, I would say. Yeah, so I'd probably...
It's horrifying if you think about it. What we're actually talking about is horrifying that it is being allowed to happen. If you went away for a week and you'd left your adult children or, teenagers, at home, and let's say they were completely old enough to be by themselves, and you came home and you realized that had been the decision. Shocking.
It is shocking, and it's unbelievable. When you think about the values that most people grew up with, who would have thought that we'd be in a world or in a country where this is actually, it's been normalized. And the normalization of extreme is part of the problem with everything, actually. The normalization of extreme. And, it goes to a lot of my concerns around things like the whole sort of woke agenda, the industrialization of the transgender movement. To me, there's a time and place for these things if you choose on an individual basis, but it all becomes industrialized. And then when we start to look at the history of these things and where they come from, and the fact that the goddess Ishtar, who was the goddess of transgenderism back in Babylonia and those sort of times, like 2,500, 3,000 years ago, by coincidence, her banner was the rainbow as well, and her month of celebration was June as well. I think that we're almost seeing the return of the old gods. That's a little bit what it feels like. And that goes into a whole different sort of spiritual side, which again, most people are completely disconnected from. But we do seem to be living in a different world than we were born into. And it seems to have happened in just one or two generations. We've seen this complete flipping of humanity and the norms, civilizational norms. And I think that's really why we're in such deep trouble now, because we've abandoned our civilizational norms, I think. And with that, ethics and morality. And I think without ethics and morality, we're all going to be, in trouble. And that's probably why we are.
You said something, disconnection of spirituality. I believe that that's been happening progressively over time in different ways. When I say spirituality, I'm not talking about necessarily religion, but just this disconnection of self that has been propagated over time. And this, I've seen kids come into my house that were in abject horror over having to sit down and have a meal and talk to people because they'd never experienced that before. They'd never they were so disconnected from their family, from their self, from their, these simple things like meal times and sitting together. They didn't know how to have a conversation.
And I think you're right. And I think, again, just in that one generation, how will those kids be when they become the societal leaders in 20, 30 years' time? I think the implications are actually really serious. And it comes down to the sort of convenience of just giving the kids iPads to entertain themselves on. But what is that really doing in the long term? What are we trading by doing that for convenience often? I mean, it's hard to bring up kids. I never knew how hard it was to bring up kids until I had my own. Then
Nobody does.
Parents were geniuses. How did they do it? So it's easy to default to a convenient fix, but we are not just betraying our own kids by denying them a family structure and family support structure. We're really impacting society in the long term because those kids are going to become the leaders of tomorrow. And it's really quite concerning. And I think that disconnect with spirituality as well. I mean, I grew up in a sort of Christian household, in a Christian community. So I sort of default to Christian norms. But at the end of the day, I think a lot of us, in fact, probably all of us, probably worship the same God, but with different packaging. The Jews, the Christians, and the Muslims all acknowledge that we pray to the same God. There's no question about that. But even outside of that, I think that people like Hindus, Buddhists, whatever it happens to be, Tantrists, whatever you happen to be, we're probably all worshipping the same God with our own packaging and our own cultural packaging of who that God is. But when you worship a God, it does give you a moral foundation. When the US Constitution was written a couple of hundred years ago now, and the forefathers sat down and started writing that and planning it out, there was a conversation that was held about need to bring religious values into the Constitution. And one of the people that advocated for this was not a Christian. But he said, I agree to this because it is a moral foundation. And that's the thing with religion or spirituality even, gives you a bit of a moral foundation. It comes down to the principle of treat others how you like to be treated yourself. And that's what society needs. We need a moral foundation, a basic knowledge of what's right and wrong. And if we have that, and if our kids have that, and we as a strong family unit can instill that in them, it guarantees the civilization continues and actually strengthens. As soon as you abandon that moral foundation, the foundation of civilized behavior is weakened and eventually erodes. So it's quite important, no matter whether you're Christian or not, to be able to instill the principles of right and wrong. And that's the moral foundation that we need as society.
Wow, this conversation has gone so many places, Alan, but I feel like it could go so many more. I feel like I could talk to you for days. We might not have time for that today, but is there anything else that you would like to bring to this conversation? Any other topics or any other...
I mean, I would just like to reiterate that I think that we need to make our own decisions. And this, again, goes back to the healthcare side of things. We need to make our own decisions of what's right for us. And maybe that goes beyond healthcare. What's right for us generally in life? So empower yourself to make the right decisions, be in touch with your intuition about what the right decisions are, and let's take control of our lives. I think that's important for people because we get into such a big mess. And again, looking over the last 5 or 10 years, and it probably goes back the last 5,000 years, to tell the truth, where we've been dominated by institutions, sects, political systems, leaders, dictators. Everybody is telling us what to do and how we should behave and how we should interpret things and who the enemy is. Maybe we should take control of our own lives and make our own decisions about that sort of thing. And if we can do that with a moral foundation, I think that we'll probably be better off than a lot of the institutions, the political systems that have been imposed upon us, which they're all doing it for their own gain, not for our gain. And I think that's another fundamental realization. It's like, well, whose health are we really talking about here, mine or yours? Whose well-being are we really talking about? Who's declaring war that I have to send my kids to go and fight? And what is the gain? What are we really doing here in a lot of things? I think we need to start questioning a lot of things. The problem is finding out the truth. And that's another thing that I think we've got to realize is that nothing we're hearing is the truth. My perception of the truth is not necessarily right, and neither is yours, but the truth lies somewhere between us. So when a doctor's telling me something and another doctor's giving me a second opinion, none of us are probably absolutely right, but the truth is lying somewhere in the middle. So we need second opinions of everything. And we need to accept that we don't know the truth. Our belief is not necessarily the truth. We just believe it is. And so what we've got to do is dig deeper and be open to the fact that somewhere between me and my adversary, the truth is lying on that no man's land somewhere, and we've just got to try and find where it is. But I think accepting that we actually don't know, if we all accepted that, we'd be much more interested in having dialogue. We shut down dialogue because we say, no, I believe this, I'm right. And as humans, that's why we go to war, because I'm always right. Maybe you're not. Maybe I'm not always right. In fact, I know I'm not always right. And I think those are the sort of big lessons. And as I say, it gets fairly philosophical fairly quickly, but it's time for us as a species to start having those sort of philosophical discussions and realizing that we've been dominated and indoctrinated for centuries. And maybe we're now getting to the point where we've got the intellectual capacity and the spiritual capacity to just know that things can be better, just to know there's a better way. And now we need to start exploring that and taking responsibility for it and truly committing ourselves to making the world a better place. Because, we all, back from the 1960s, it's like, hey, world peace and all this type of thing. But how we went about it wasn't the right way. Now, I think we've got to, at this particular moment in time, because things have got so extreme, we actually have an opportunity to break beyond the boundaries that have always divided us. It's so interesting when you look at communities that call them anti-vaxxers. So people who are suspicious of the vaccine, for instance. And obviously the big one over the last 5 years has been the COVID vaccine. But it's so interesting when you look at that community that stood against the mandates. It didn't matter what skin color you were, what language you spoke, what religion you were. If you were on that side of the fence, you suddenly became family. You suddenly became connected. And religion, language, skin color made no difference. You were together in your marginalized belief. You were in that minority, but you were standing together. And how quickly we saw beyond race, language, and religion, which have always been the dividers of humanity. And maybe that lesson is a lesson that we need to realize we're all human. We all have wants and needs. We all care about our kids. We're all being sort of victimized to some way by the system. And maybe when we start standing together and realizing that we're all just human and we're so much stronger when we stand together, we can build the next society after all of this chaos that will be based on the understanding that we're all human and the empathy that we all show for each other, no matter what skin color you have, no matter what religion you are, no matter what language you speak. We have the same fundamental feelings, wants, and needs. That, I think, is going to be a maturing experience for our species. And if we can manage that transition, then we could become children of the stars, because then we're moving beyond our petty differences to becoming children of the stars and colonizing the universe. And maybe this is all just part of pruning the bush so it grows back stronger. So maybe we're actually at a remarkable and wonderful juncture of human history, even though we're feeling the trauma of it every day. But if we look beyond the trauma, maybe this is our moment to actually mature finally. So I don't know. Hopefully it's a positive story. Who knows?
Well, I want you to share with people a little bit, because there's I'm going to guess that most everybody listening to this is going to be interested in some of what you've had to say, if not all of it. So how can people find you? How can people see you and connect with you and maybe even purchase your book? How do we get to Alan?
Probably the easiest way is, well, there's a couple of websites that I'm associated with, CanadaHealthAlliance.org, traceable on there. Our wellness center also has its own website, which is ReVitalifeWellness.ca. So wellness. And then my own personal email address that people can contact me on is Alan Brough, one word, LANBROUGH, at protonmail.com. I must just apologize, though, because I get tons of email. So I might be a little slow in replying, but I do try to reply to every email that I get. And I love connecting with like-minded people. And I love, giving advice and helping people. I think our mandate is to do that. So if you email me, I will definitely try and connect with you. But as I say, ReVitalife would be a good one. And I think Canada Health Alliance is a good resource for most people to have a look at anyway. And we've got a lot of events that we promote on there. We've got the newsletters, we've got the library, which has got tons of information, So I think there's good resource there. But yeah, people are definitely welcome to email me, and if it's urgent, email me again if I don't reply. Get yourself to the list and I'll respond. And as I say, you're always going to get a degree of hate mail, but that's fine. We're used to that as well, which is, again, part of the maturing experience.
Well, it just means that you are doing something right.
Which is a good way to look at it. Yeah.
Yeah.
No, thank you for giving me the chance to do a bit of a shout out for myself. Yeah, thanks.
Yeah. Well, I have so appreciated this conversation, Alan, and I appreciate your perspective. I appreciate the patterns and the things that you have been able to see and recognize being from where you grew up in a war-torn country, and applying that a little bit to what we're going through right now. I appreciate your perspective and your willingness to dive into this healthcare conversation and the actions that you're taking to help people with theirs.
Yeah, and I think what you say is right. It is perspective. So I know we've got all the disclaimers that we need to, but it is my perspective. But I think what I'd encourage people to do is to get your own perspective. It's my perspective, it's your perspective, but what is your perspective? What is important to you, and explore that, because the only person that can really improve your life and your well-being is yourself. And the more you can empower yourself and give yourself knowledge to do that, the more enriched your life will be, I think. So I think if I'm going to leave anybody with a thought, that's probably what the thought is going to be. So thank you for giving me the opportunity.
Well, thank you, Alan. Well, we'll leave that there.